Can you hear me?
Yes, sir.
Yes, sir.
So B12 deficiency is synthesized exclusive by microorganism, and humans must rely on dietary sources such as animal products, including meat, egg, fish, and milk for their needs. So unlike folate, older children and adults have a sufficient vitamin B12 stores to last 3 to 5 years. So in young infants born to mothers with low vitamin B12 stores, clinical signs of cobalamin deficiency can be apparent in first 6 to 18 months of life. So this is the metabolism showing the B12 absorption. So diet चाहिँ तिम्रो fish and egg चाहिँ B12 दिन्छ हैन. B12 चाहिँ इन्ट्रेन्सिक फ्याक्टर स्टोमक है HCl ले गर्दाखेरि तिम्रो इन्ट्रेन्सिक फ्याक्टर र B12 चाहिँ तिम्रो अब्जर्भ हुन्छ कहाँ आइलियममा. And ileumबाट चाहिँ ट्रान्सकोबालामिनले चाहिँ ट्रान्सपोर्ट गरिदिन्छ इन बोन म्यारो लिभर र अदर टिस्युजमा चाहिँ है. यो चाहिँ B12 को चाहिँ ट्रान्सपोर्टेसन र अब्जर्प्सन. So etiology, inadequate B12 intake in case of maternal deficiency caused by pernicious anemia or gastrointestinal disorders such as H. pylori infection, celiac disease, Crohn's disease, or pancreatic insufficiency might cause B12 decrease B12, or previous gastric bypass surgery, treatment with proton pump inhibitors, or intake from a strict unplanned vegetarian diet has been implicated with inadequate B12 intake. Or impaired B12 absorption in case of gastric surgery or medication that impair gastric acid secretion may result in intrinsic factor deficiency. Or pancreatic insufficiency can also lead to cobalamin deficiency because of impaired cleavage and intrinsic factor complex formation. Patient with neonatal necrotizing enterocolitis, inflammatory bowel disease, celiac disease, or surgical removal of terminal ileum may be impaired absorption of vitamin B12. And overgrowth of intestinal bacteria with diverticula or duplication of the small intestine can cause B12 deficiency by consumption of the vitamin or by splitting of its complex with intrinsic factor. Also, that can impair B12 absorption, say fish, tapeworm, or diphyllobotherium. So classic pernicious anemia usually occurs in adults, but it rarely affects children. So this disorder, so juvenile pernicious anemia, in such cases, it's usually rare. In such cases, there is antibody against the intrinsic factor, hydrogen potassium adeno ATP, proton pump in gastric parietal cells. These children have additional immunological abnormalities such as cutaneous candidiasis, hypoparathyroidism, and endocrine deficiency, atrophy of gastric mucosa, achorhydria may occur. So intramuscular or intranasal vitamin B12 should be administered regularly in those cases of pernicious anemia. So clinical features are children with cobalamin deficiency often present with non-specific manifestations such as weakness, lethargy, feeding difficulties, failure to thrive, irritability. Other common findings are pallor, glossitis, vomiting, diarrhea, and icterus. Neurological symptoms can be paresthesia, sensory deficit, hypotonia, seizure, developmental delay, developmental regression, neuropsychiatric changes, and brain and spine MRI changes. So anybody can say, कुन चाहिँ spinal cord मा चाहिँ affect गर्छ यसले if there is B12 deficiency. Spinal cord kun portion ma? Is there any term?
SCD, sir.
Oh, good. So subacute combined degeneration of spinal cord. So there is demyelination of the posterior as well as lateral portion of the spinal cord. So posterior tract ma there is loss of vibration or position. Right? So you should look for if there is B12 deficiency, say subacute combined degeneration of spinal cord. Right? This so posterior tract ma there is loss of vibration and position. Lateral ma involves dorsal cerebral tracts, and arm or leg this ataxia गर्न सक्छ. अर्को चाहिँ cortical spinal tract मा नै involve गरेर spastic paralysis पनि गराउन सक्छ. So you should be aware of subacute combined degeneration of spinal cord that is caused by B12 deficiency. So these are The figure in which we can see B12 deficiency features such as fatigue, mood swings, depression, anemia, immunodeficiency, neuralgia, tingling sensation on hand and feet, unsteady gait, paralysis, muscle weakness, muscle cramps, tremors, indigestion, pale skin, burning tongue, inflamed and mucous membranes. So laboratory findings the anemia resulting from cobalamin deficiency is macrocytic with prominent macroovalycyte of the RBCs. The neutrophils may be large and hypersegmented. In advanced cases, neutropenia and thrombocytopenia can occur, stimulating aplastic anemia or leukemia-like features. So serum vitamin B12 are low, and serum concentration of methyl malonic acid as well as homocysteine are usually elevated. I've already said concentration of serum iron and serum folic acid are normal or elevated. Serum lactate dehydrogenase activity is markedly increased, reflecting ineffective erythropoiesis. There might be moderate elevation of serum bilirubin. There might be excessive excretion of methyl malonic acid in urine, which is a reliable and sensitive index of B12 deficiency. So diagnosis, a comprehensive medical history is essential to the clinical recognition of possible B12 deficiency. Cobalamin deficiency is usually identified by measuring the transcobalamin bound vitamin B12 in blood. In untreated patient, methyl malonic acid and total homocysteine levels are often helpful because they are generally elevated in majority of those with clinical signs of B12 deficiency. Again, excessive urinary malonic acid secretion is also sensitive test for B12 deficiency. If B12 deficiency have been confirmed and there is no evidence of inadequate dietary intake, or in the case of an infant, inadequate maternal B12 malabsorption should be investigated. In the past, ceiling test, a measure of cobalamin absorption, was the gold standard, but it is no longer available with no comparable replacement. Also, anti-intrinsic factor antibodies and anti-parietal cell antibodies are useful for diagnosis of pernicious anemia. Right? So, यो चाहिँ ceiling test को बारे हो, है? So this is short algorithm. So ceiling test मा चाहिँ एउटा चाहिँ oral dose of radioactive B12 दिन्छ है. अर्को चाहिँ intramuscular है दिने हुन्छ, that is non radioactive B12. यसले चाहिँ के गर्छ भने तिम्रो चाहिँ body मा तिम्रो B12 को receptors-हरु चाहिँ यसले चाहिँ तिम्रो भर्दिन्छ है, जसले गर्दाखेरि चाहिँ we can know whether तिम्रो intrinsic factor deficiency हो कि हैन अरु कजले गर्दाखेरि चाहिँ B12 deficiency हैन. के गरी चाहिँ हामीले चाहिँ यो दुईटै दियो है, एउटा नन रेडियोएक्टिभ B12 र ओरल डोज अफ रेडियोएक्टिभ B12 दियो भने इफ तिम्रो इन्ट्रिन्सिक फ्याक्टर छैन भने चाहिँ तिम्रो चाहिँ युरिनमा चाहिँ नर्मल भन्दा कम चाहिँ दैट इज लेस देन 10% चाहिँ तिम्रो रेडियोएक्टिभ B12 पाउँछ. तर के गरी इन्ट्रिन्सिक फ्याक्टर रहेछ भने चाहिँ किनभने त्यो सबै अब्जर्भ भइसक्यो हुन्छ, तिम्रो यो सबै रेडियोएक्टिभ B12 दिइसक्यो हुन्छ हैन. अर्को चाहिँ आइएम B12 दिइसक्यो हुन्छ. त्यसमा चाहिँ तिम्रो युरिनको B12 लेभल चाहिँ हाई हुन्छ किनभने सबै रिसेप्टरहरु तिम्रो अकुपाइड विथ B12 भइसक्यो इन केस अफ नर्मल है. व्हेयरएज इन केस अफ इन्ट्रिन्सिक फ्याक्टर डेफिसिएन्सी भयो भने चाहिँ तिम्रो रिसेप्टर तिम्रो इन्ट्रिन्सिक फ्याक्टरै नभएपछि चाहिँ तिम्रो अब्जर्प्सन कम हुने भयो र युरिनमा चाहिँ त्यो रेडियोएक्टिभ न्यूक्लियोटाइड B12 चाहिँ कम हुने भयो. अब हामीले जब इन्ट्रिन्सिक फ्याक्टर दिन्छौं है अनि त्यो सर्कुलेसनमा गएर युरिनमा आउँछ, त्यसबेला चाहिँ तिम्रो नर्मल हुने भयो है. युरिनमा चाहिँ तिम्रो के गरी मोर देन 10% भयो भने चाहिँ के गरे हामीले B12 प्लस इन्ट्रिन्सिक फ्याक्टर दियो भने चाहिँ त्यो चाहिँ पर्निसियस एनिमिया हुने भयो है. अनि के गरी नट करेक्ट भएन भने चाहिँ दैट इज माल अब्जर्प्सन है. सो यसरी चाहिँ हामीले चाहिँ सिलिङ टेस्ट चाहिँ युज गर्न सक्छ, तर अहिले चाहिँ खासै युज गर्दैन है. So treatment is cyanocobalamin is available as a nasal spray or parenteral injection पनि दिन मिल्छ है. The physical requirement for vitamin B12 is about 1 to 3 microgram per day. So this is the clinical features and signs and symptoms, which is difference between the folic acid as well as B12 deficiency. So anemia हुन्छ. So the folic acid deficiency मा चाहिँ very occasionally हुन्छ neuropsychiatric symptoms हैन, तर B12 deficiency मा चाहिँ gradual progressive symptoms and signs of anemia. तर neuropsychiatric illness चाहिँ हुन्छ है, and might lead to dementia as well है. Folic acid deficiency मा चाहिँ neural tube defect है, vascular disease which is associated with high levels of homocystinuria हुन सक्छ. In case of B12 deficiency icteric हुन्छ, glossitis हुन्छ, angular stomatitis हुन्छ हैन, and subacute combined degeneration of spinal cord हुन्छ, and rarely optic atrophy हुन्छ है. अर्को चाहिँ तिम्रो ल्याब इन्भेस्टिगेसनमा चाहिँ तिम्रो एमसीबी हरू सबै सेम हुन्छ, पेरिफेरल ब्लड स्मेयर पनि सेम हुन्छ. पर्निसियस एनिमिया चाहिँ B12 डेफिसिएन्सीमा हुन्छ, whereas folate acid मा हुँदैन. होमोसिस्टिन लेभल चाहिँ दुईटामै एलिभेटेड हुन्छ, while methyl malonic acid is elevated in case of B12 deficiency, while it's normal in case of folic acid deficiency. So यो चाहिँ megaloblastic anemia को भयो. So thank you. So if you have any queries, you can ask me. केही छ सोध्नु?
No, sir.
Okay, thank you class. अनि अर्को क्लास चाहिँ कहिले गर्ने? मन्डे हुन्छ है? ल्युकेमिया र अर्को लिम्फोमा छ.
हुन्छ सर.
हुन्छ ल, thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you,
Thank you,
sir.
sir.